Hello, my name is Neil Sengupta from Beth Israel Deaconess Medical Center in Boston, Massachusetts. The title of our study is Risk Factors for Adverse Outcomes After Hospitalization for Lower Gastrointestinal Bleeding, and this study was accepted for publication in Mayo Clinic Proceedings. So lower gastrointestinal bleeding is very common in the United States and is associated with significant morbidity, costs, and healthcare resource utilization. Unfortunately, our understanding of the natural history of lower gastrointestinal bleeding is rather limited when compared to patients who present with upper gastrointestinal bleeding. Additionally, our understanding of how patients do after they are hospitalized for lower gastrointestinal bleeding is relatively limited. We conducted a prospective observational study investigating risk factors that are associated with adverse outcomes for patients who are hospitalized with lower gastrointestinal bleeding. Our primary aims were to describe risk factors for patients who are readmitted within 30 days following hospitalization, for patients who have rebleeding after hospital discharge, and for patients who have post-discharge mortality. We enrolled 277 consecutive patients with lower gastrointestinal bleeding over a one-year time frame to our center. We measured in-hospital endoscopic utilization, etiologies of lower gastrointestinal bleeding, as well as transfusion requirements. We then called all patients 30 days after discharge to determine whether patients had any hospital readmissions, had any episodes of recurrent bleeding, or whether the patients had died following their initial hospital discharge for lower gastrointestinal bleeding. During the study, 2% of our cohort died while they were initially hospitalized for lower gastrointestinal bleeding. When looking at risk factors for in-hospital death, we found that patients who developed lower gastrointestinal bleeding while already hospitalized for another condition were more likely to die while in the hospital. The most common etiology of lower gastrointestinal bleeding during the study timeframe was diverticular bleeding. And colonoscopy was useful in diagnosing patients with lower gastrointestinal bleeding in approximately 46% of cases. Moving on to post-discharge outcomes, 21% of the cohort were readmitted within 30 days of hospital discharge. Risk factors for early hospital readmission after hospitalization for lower gastrointestinal bleeding included patients who developed in-hospital lower gastrointestinal bleeding, patients with active malignancy, and patients with an increased number of comorbidities and discharge medications. 8% of the cohort had recurrent bleeding within 30 days of initial hospital discharge. Other common causes of hospital readmissions included infection, volume overload, renal failure, and thrombotic complications. Patients with diverticular bleeding or patients with inflammatory colitis were more likely to come in with recurrent bleeding. Finally, 3% of the population died after hospitalization within a 30-day time frame. Risk factors for post-discharge mortality included patients with in-hospital lower gastrointestinal bleeding, patients with higher Charlson comorbidity scores, and patients with congestive heart failure or active malignancy. In summary, we found that patients who developed lower gastrointestinal bleeding while already in the hospital were a high-risk group and were at increased risk for adverse post-discharge outcomes. We also found that 30-day readmissions following hospitalization for lower gastrointestinal bleeding are relatively common, and patients are frequently admitted for conditions that may be related to their initial episode of lower gastrointestinal bleeding, including infection, thrombotic complications, volume overload, and renal failure. Patients with these risk factors, including patients with in-hospital lower gastrointestinal bleeding, patients with active malignancy at the time of lower gastrointestinal bleeding, and patients with a higher Charlson comorbidity score, should likely be followed very closely after their initial hospital discharge after lower gastrointestinal bleeding. Steps should be taken to reduce the risks of adverse outcomes for this population of patients who are admitted with lower gastrointestinal bleeding. Specific measures that should be studied moving forward should be maintenance of infection control, making sure that volume status is adequate, and ensuring that patients are continued or resumed on anticoagulants and antiplatelets, given that several patients came in with thrombotic complications after hospitalization for lower gastrointestinal bleeding. Future studies are necessary to design strategies to mitigate the risks of early hospital readmission and recurrent bleeding in this population of patients admitted with lower gastrointestinal bleeding. This would serve to reduce costs and overall healthcare utilization while improving patient care. Thank you very much for listening.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.